Hey everyone, Dr. Perlman, and it is February 2nd, Friday, and I'm coming to you from my house. And right now I am going to look at the ice bath. Not exactly a cold plunge, but it will be an ice bath nonetheless once I get going to practice what I preach and start to really take advantage. So I want to talk a little bit about healing, tissue, resilience, injuries, adjustments, things like that, and I'm going to actually go fast. For once, I'm going to make it really quick and upload this whole thing. Number one, we don't get old and like, oh, I'm getting old sucks. I mean, yeah, it's kind of true, but it's a misnomer. And what I mean by that is, it's like your tissue is less resilient as you age because of vascularization issues or less than optimal vascularization or no vascularization to certain parts of the tendons and or ligaments and or cartilaginous parts of the joint that are important, which give you flexibility as a child. And then as we age and we begin to mature and become more stable over time, because stability is very integral as we age and our body becomes wiser, but the tissues become less resilient. Therefore, we need to do things like chiropractic, yoga, weightlifting appropriately, kind of finding like a good routine to stay fit, to stay active, to move our bodies and get the help we need to recover. Supplementation, the right foods, diet matters. It matters a lot. Or I should say nutrition. Diet's a bad word. Okay, so that's number one. Number two, if you're a 25-year-old baseball player, or even for me, sometimes the people I work with younger, so maybe like a 20-year-old baseball player who comes to me with a sharp pain behind their pitching shoulder, and I give them one adjustment and I don't see them in 2 years, and then one day we're reaching out and they respond and say, hey, haven't had any pain since, thanks. You know, that's not the expectation for a 44-year-old everyday, dare I say, bodybuilder. That bodybuilder or that CrossFitter or that person that trains hard and lifts heavy, they're going to not have a result of a sharp stabbing pain, one adjustment for the shoulder complex, and they're better. So keep that in mind based on the tissue resiliency we talked about. Lastly, people I've been seeing in the last few weeks with a lot of very positive feedback from patients, and I'm very happy to provide quality chiropractic when that is the case. And I hope, and it is my goal for it to always be the case, but somebody said to me, how often should I get adjusted? And I said, honestly, it depends. Because the answer will always be it depends. But the answer is that there is no set answer. For some people, they may feel a necessary or a necessity to get adjusted, 2 times a week for them because that's the way they feel it is, best for their body. Other people, it might be, 1 time a month, 1 time every 3 months. If you acutely get injured or have something that, flares up and has got you locked down, whether it be your back, your neck, your shoulder, your wrist, your foot, you might need to come in 3-4 days in a row before you're released from care. Call that a short acute, sacrifice for a trial of care, or a trial of care based on an acute exacerbated condition. So just please, guys, when I make this video, keep that in mind, because there's no set routine. There's no set 100% definitive thing. Everybody is unique. Every situation to every injury and or pain you're feeling is super unique. And the utilization of the adjustment, like I made the other day, chiropractic is many things to a lot of people, and that's okay. Those necessities or the reason your body might need an adjustment is so unique to that situation. I rest my case. Everyone have a great weekend. I will not be in this Saturday. I am taking the weekend off. I need the rest. I need to recover. Starts with my ice bath, and that is what I'm doing now. Have a great weekend.